Today we are taking your physical therapy questions and answering some of them.
That's right. Well, let's just get right to it, Mike.
I guess, but we have an intro song first.
I'm Brad.
I'm Mike, and behind the scenes we have Bob, and together we're the most famous physical therapy group on the internet.
You need to say that with more passion.
That's how Brad...
In my opinion, in our opinion, of course.
That's how Bob used to say it. Anyway, if you're new to the channel, like this video, make sure to subscribe, and if you have questions in the future, leave them down below, and we'll pick some to answer.
Good.
Let's get to it.
Right, first question.
So this username is really hard to say, but Laney's Majovitz says, "Hi guys, I suffer from osteoarthritis in my fingers. Sometimes it's so painful that it wakes me up at night. Can you help me with some exercises to relieve the pain?"
We would absolutely love to. Actually, this we're going to do what we call is the... it came right from Bob. It's the Mayo Clinic six-pack. It's got nothing to do with a six-pack of beer. I'm from Wisconsin. That came to my mind. But here it is. There's 6 specific exercises, and it's going to start with your hand. You can do this both hands at the same time. We'll just do one. Straight up like this. Okay, get as straight as you can. If your fingers are hooked from the arthritis, you can try and straighten them a little bit with the other hand. Get a little stretch on there. And then we go to the hook. Simply like this. There will be a gap between your fingers. So we're just trying to get those joints and the fingers moving so you can go back and forth if they're stiff.
What if I want to call this the claw?
Yeah, well, you call it whatever you would like, Mike. Let's get on to the next one. Now we're going to go to the flat fist. This is where you bring your fingers down and you actually flatten out so you can see your fingernails. Like Mike's got an excellent position of that, and you can repeat that. If they're not going down, you can give a little help with the other hand and straighten them. Spend about 10 to 15 seconds on them if they're tight, okay? And then we go to the regular fist where you curl the fingers underneath, curl the thumb around, and you're making an actual fist, a full fist. And work that. Sometimes the other hand can go over and stretch them in just to get a little more stretch with that. And then the tabletop is simply like this. Flat tabletop like this. Do what you can to get it straight as you need. And then touch, thumb, first finger, thumb to second finger, fingertip or thumb tip to fingertip, and do that 1 or 2 times. And do that with each hand or again, both at the same time. It's a wonderful way to get complete range of motion throughout your fingers.
And when you're done, clap. That's more finger exercises.
There you go. All right, let's go to the next one.
So our next question comes from Blue-Eyed Soul Man, and the question is, how about traction, and can traction be administered to someone with moderate to severe scoliosis?
The answer is yes. However, if you have severe scoliosis and pain associated with it particularly, you need to see your doctor and get it okayed. If you just have scoliosis with no pain, but you have it, you can do this as long as it does not create pain. We're going to show you 3 options for traction. The first one is a simple one on a firm chair with good firm armrests. You're going to relax your core muscles around your stomach, and you have to have strong arms for this. If you don't, it will not work. We'll go to the second option here, and you simply push up, and then I'm going to bring my legs out, and right now my core muscles are very loose, and I can feel my back actually getting a little bit of gravity traction. Again, I'm going to hold it. Your arms will probably get tired, so maybe 5 to 10 seconds. So you get arm strengthening and traction. If this doesn't work for you, fine. Let's go to the second option.
Now, for this, you're going to need something to hang on to, a pull-up bar. You can technically do this on an open door, but it's a little bit different. So what you're going to do is grab on and slowly sit your butt down and just kind of hang like this. I'm relaxing my stomach muscles. Boy, I can't talk today. And that way it's going to let that traction apply to your spine. Now, if you're doing this and you have a full pull-up bar where you can actually dangle your legs, that is fine. You just don't want your core engaged holding up like this because it's not going to allow the spine to separate like you need it to.
And again, no pain should be experienced with this. It should feel good. If it's painful, you scratch it off. It's not an option.
You can just start with like 15, 30 seconds if it feels good. If you have if you can tolerate, boy, I can't talk today. You can go for longer durations, like a minute if you want to, as long as it's feeling good. Now, there are some other traction options available, but we don't want to spend a lot of time on this. So we will put a video link down below. Top 3 ways to apply traction decompression to the spine and back. This one involves actual traction units. Some of them are Saunders units and some of them are inversion tables, so click that video link if you are interested in that. The next question comes from Christy Wells Reese, and they say, I wish you guys would do a video on exercises we could do for sciatica pain in the behind, thinking of me buttock. Until it happened to me, I didn't know it was even a thing.
Okay, this is kind of a difficult one to deal with, Christy, so we're going to give you 2 simple exercises. There could be a lot more, but you could try these. If they offer immediate relief and after you're done, it continues to feel good, do them. If they do not feel good and the pain does not improve, scratch both of them. It's one of those things you'll need to see a therapist directly.
If these stretches don't help, we do have tons of videos on sciatica pain. It's the same exercise as if it's in your butt or down your leg or just in your back. So just a heads up. To do the first stretch we're going to show, it's the same stretch, just done different ways. If you're specifically having one-sided pain, so typically that's what it is with sciatica, say it's my left side, what I'm going to do is do a stretch to try to open up the spine and decompress it. So I'm going to grab on the top of the door frame. You can certainly use a pull-up bar, whatever you have. I'm going to relax, bend my knees, and I'm going to lean into it. Leaning into it like this is going to separate those vertebrae, give that disc some room to breathe, and possibly take pressure off that sciatic nerve that is irritated right now. So you're going to hold this for roughly 15, 30 seconds. Make sure to relax and breathe, and do it a couple times a day.
And if that's not an option because you're too short or the door is not solid, you can simply take a stick 4 to 5 foot long. You can use a broomstick. It has to be solid, rigid. Put it on a chair next to you so it doesn't slide. If it does slide, you take your shoe off and put that right there. Reach up, grab here. If it's my right side, the right-sided pain, then you're going to lean without letting your hand slide, and it's going to stretch this side. Again, I'm going to repeat this. When you do this, it should make that sciatic pain you're experiencing get better while you're doing it, as well as when you're done holding it for, like he said, 15 to 30 seconds. Walk around. It should continue to feel better. If it does not feel better while or after, scratch it. You do not want to continue that exercise.
I'd like to mention your door does not have to be on wheels or stairs like that. All right, question 4 comes from Connie German Girl. Do you have any stretches for people with arthritis in the lower back? Hugs from Texas.
Well, you're in luck, Connie. We have some excellent stretches to get that arthritis loosened up. You can do it in bed before you get out of bed or lie down on a carpeted floor throughout the day. The first one, Mike is going to actually show a modified versions of what I'm doing in a chair. A firm chair works best with armrests. Bring your knees up like this low and you're lying down. And we're simply going to relax, keep your hips still with your hands here, and just let your knees go back and forth. I always tell my patients you're doing like a windshield wiper in a car, and you can let one knee separate a little bit, and I can feel my lower back actually loosening up right now a little bit. It's a nice stretch. Do it 10 to 15 repetitions. If any of these create pain, you do not do them. How are you doing, Mike?
I'm doing just fine.
Let's go to the next one then.
So the next one, you're going to do single knee to chest to begin with. Now, if you're in a chair, just grab one leg, bring it up as far as you comfortably can. If you're limited, just a small motion, that's fine. You're just going to kind of hold it there for a few seconds. You can either hold this for 15 to 30 seconds in one spot if that feels good, or you can kind of do some repetitions, just bring it up and back down. Make sure to do this on both legs. If this is easy, you can do both knees to chest, which is a little awkward in the chair, so we would recommend this one laying down like Brad is showing.
There you go. Yep, it's as simple as that. Relaxed again. They should feel good. Get those joints and the vertebra nice and move and relax. Let's go to the next one.
So the last one is the prayer stretch. Now Brad is going to show it in bed, and you can do this in a chair. So what I'm going to do in a chair is just sit up, arch my back, lift my arms above my head, and stretch this way. And then you can even come back down and go to what is comfortable. Notice I'm having a nice straight back. I'm not rounding like this. Just go down to what you feel is comfortable, just getting that spine moving. Obviously, the version Brad is showing is quite a bit different. Do you want to explain how to do that one?
Sure. So on your knees, hands out, and you just let your bottom go back to your heels and feel the stretch right across your back there. If you want to get one side more than the other, simply place one hand over the the other or this way, and do it as many repetitions as you feel comfortable. Typically 5, maybe up to 10 maximum.
Now, one other thing we kind of talked about with the other two with back issues or sciatica is you can certainly try hanging if that's an option for you personally. Again, you're going to need something sturdy like a pull-up bar or hanging handles to hang on to. Again, just distract, and that'll get more of a traction in there where the other ones are working on rotation and flexion and extension patterns.
Again, good luck with these. Only do them if they feel good while you're doing them as well as afterwards. Good. Let's go on to the next one, Mike.
Okay, our last question comes from Placebo Reality. Hopefully this isn't a placebo. Anyway, can you please do a video on pelvic tilt? Is it a myth or true? And some stretches we can do to help if you have a anterior tilted pelvis. So for those of you that aren't aware, this is your pelvis and your spine. An anterior tilt means you are arched forward like this. I'm obviously exaggerating on this model, and your butt sticks up. This can cause a lot of low back pain issues, hip issues, anything related to the hip or pelvis in this region. Typically what is common with this is people have tight hip flexors. Your hip flexors are located in the front of the pelvis. If they are tight from sitting too much and not standing up or stretching, they can cause this pattern. So it is true, this can be a problem, and in order to fix it, most of the time we need to stretch the hip flexors.
Now, the hip flexor stretch is very well known, but there's only one way to do it to get the rectus femoris, which happens to be the muscle that gets neglected most of the time. So we got this from Rick Olderman. He has had extreme success with it, written books, taught therapists it. Can you show how to do the Thomas, well, we call it the Thomas test, but it's actually the Rick Olderman hip flexor stretch and be complete.
So what you're going to want to do is sit on a edge of a firm surface like I am here. If you happen to have stairs, this is the top and your stairs go down. You could try it there. We've met some people that have done that. You can also do it on a tabletop, whatever you have. Hopefully your mattress is firm enough. You can try it there as well. Anyway, what you're going to do is lie down, and you're going to bring both knees to chest to begin with. Now, if I'm doing my left side, I'm simply going to drop it down. Once I'm here, to get that rectus femoris, I'm going to bend my knee, and it's important to pull the opposite knee up towards your chest. So you can see when I do that, my hip wants to go up a bit. Try to keep it down. Hold this for 30 seconds. And also make sure your leg is staying in a nice straight line. Don't let it wander out to the side like this or drift in too far. You should feel a stretch. If you are stuck way up here, your hip flexors are tight. If you can get to the mattress or down a little bit, you're probably okay and it's not causing too much discomfort. But again, try to hold this stretch and check it on both sides. Most people are going to notice a difference from one leg to the other. It may not be super noticeable visibly, but you will definitely feel it when you are stretching.
There you go. Nice work, Mike. All right, so those are the end of our questions and our answers. Good luck with them. You can make some comments below of anything you would like to so that we know you went to the end of the video. Is that right?
We would like you to ask your questions,
that's right.
and we will pick a handful of them. And as for the sciatica stretching video, it should show, not the stretching, the traction video. It should show on the screen right now.
There you go. And subscribe.